Today's patient has a couple of pretty thick, discolored fungal nails, one on each big toe, and the rest of her nails are just really long because she hasn't been here in almost 6 months. But you hear patients talk about the oral antifungal medications and whether they work or not. And I'd like to show you a patient I saw yesterday for a 6-month follow-up. Now, 6 months is pretty rapid to have this kind of a change. And usually it takes between 10 and 18 months for an adult big toenail to grow all the way out, but this patient resolved her fungal infection in 6 months. So here's what it looked like when we started. And here's what it looked like when she came in yesterday at just 6 months. So as you can see, the results are pretty remarkable. And so the answer is yes, the antifungal medications work. No, not everybody is a good candidate to take them. And yes, we do blood testing along the way just to make sure that they are not affecting the liver. So with that said, I hope that you enjoy today's video. All right, so you've never had a podiatrist do your nails for you before, huh?
I don't know if Dr. cut them when he did the fungus, but no, I've gone a couple times to, they'll have, what do you want to call it, little meetings or little classes, like at Robbinsdale Community Center, I think I went. A nurse comes.
Oh, where the nurse comes and does foot care?
Right, and I have been to that a couple times.
Okay. Well, you're welcome to schedule every couple months here.
Okay.
Because of your diabetes.
Yeah.
That's something your insurance will cover so that you don't end up with wounds like your daughter has.
Good.
Or infections that are limb-threatening.
Yes. A lot of places, I'm surprised, will not do it anymore.
Nope. That's my little soapbox that I get on. That if they're not doing this kind of care, preventively. Has this one bothered you before?
It doesn't bother me every day, doctor, but that hurt.
Sorry.
No. I understand.
But if they're not going to be doing this kind of care for their diabetics, how can they say that they're providing preventive care?
Exactly. I agree.
So, whoops.
Why do they hurt like that? Do they get tender or something under there sometimes?
Yeah, because they're thick, and when the nail starts to grow like an upside down horseshoe, the skin will fill in underneath.
Okay.
So that can hurt when you trim it.
Yeah.
How's your summer going?
Pretty good. Pretty good. My mother had passed away in February, and she lived to 93, so she had a great life. But we just did last weekend. We're starting to get rid of, I hate to use that word, sell some of her things, divide it up. I, of course, took a small trailer home.
Yeah, that's hard. What do you keep as a keepsake?
Right.
Because you love her, and what don't you need?
Yep. That's right.
My brother-in-law, he had some grandparents who had told all their grandchildren to put their name on the back of anything they wanted with a piece of masking tape.
Yes.
So he walked out the back door and put his name on the side of the house.
Ooh, did that work?
No. But I thought that was very funny.
But Mother wasn't even in her house anymore, and we had one large sale that she was an antique lover,
Oh,
and she collected good stuff and bad stuff, and she loved to refinish. And as you get older and you can't do these things, your mind doesn't always let you realize that, you know.
Yeah.
So
you keep collecting all
so
the
you
things.
keep collecting, right?
Was it like a hoarder lived there, or?
No. But it was, you know, her basement was rows and rows of tubs of
Oh,
different things, and she was great at going to sales. And at the end, if you stay to the very end, you can get a whole box for 50 cents or $1. So Mother would buy those boxes. You know what was in there usually? Maybe one thing that was good.
it's like a treasure hunt.
It is, that's right. But we don't have any real estate or anything. That had all been sold, so.
So you're going through bins of garbage looking for the gems.
We did the furniture last weekend, so that's done now. And now we're starting, yes. My sister's coming up in a couple weeks. She's bringing the jewelry.
Ah,
And there's a few really nice pieces, and they're all nice, but most of them are costume. So we'll go through that stuff. We've gone through the clothes.
all right, I'm gonna do all these little ones first. I'll come back to the thick ones.
I'm sorry, that's involuntary.
Right.
Almost.
I know, don't worry.
All right. This one might hurt.
All right, so that's gonna be a lot more comfortable.
So would you call these moderately thick, average thick, very thick?
Your big toenails, I would say, fall under the very thick category.
Okay.
The baby, or the second toe there, I would go with mild to moderate, but, yeah, so they would definitely be uncomfortable in shoes. And we'll be able to get them a little bit thinner next time I see you. If we do them too thin all at once, they'll be painful.
Okay.
Are you wearing shoes and socks today?
Yeah.
Okay. In the summer, I always ask, because when people are wearing sandals, most people don't want lotion. So you want to slip and slide around in the sandals. So we have our before picture. Now what we'll do is we'll take a blood test today.
Okay, I was gonna say, do you take it right here?
Yeah, now when was the last time you had that done at your primary?
I think I saw a doctor in March.
March, okay, so that's been 3 months. So what we'll do is we'll take the blood test today, and then assuming that everything looks good, we'll go ahead and get the medication started.
Okay,
And we'll have our before picture, so in 6 months we'll compare, is it making a difference or not?
Okay,
And determine whether we keep going.
all right, sounds good.
All right, well, thank you for letting me do the video.